Hello, everybody. This is Ask Dr. Bob, and Ask Dr. Bob is where you all get to ask me, Dr. Bob. Bob Gabbay, the Chief Scientific and Medical Officer for the American Diabetes Association. You get to ask me your questions about diabetes. And so this is the 8th episode already. So thank you all for watching, and please tell your friends about this. And, you know, we've been having themes, and this theme it is Men's Health Week. And so in honor of Men's Health Week, we have a number of questions that you've all sent in, and I'm going to start answering them. So please ask any additional questions through the chat, and I will get to as many of them as I can. So let's get started. So the first question is, how does diabetes affect men differently than women? If so, well, I wouldn't say that it affects men differently per se, but maybe men come into diabetes with maybe some other issues or other things to think about. And so let me explain what I'm talking about. So many of you may know that men in general, forget about diabetes, in general have a higher risk of heart disease. And so that higher risk of heart disease, and diabetes increases the risk of heart disease further, it puts men at very high risk for heart disease. And so that's something we need to think about in reducing that risk of heart disease. Men also come in often with more likely to have other risk factors. So what do I mean? They're more likely to have high blood pressure. They're more likely to smoke. And so therefore, their risks of complications because of those other things that they may come in with when they're diagnosed, or may have at the same time of diabetes, puts them at greater risk for complications. And then we talked about, on one of the other episodes, we talked about preventing amputations. And the American Diabetes Association has a big effort to try to address that. And one of the leading causes of amputations is peripheral arterial disease, the clogging of the blood vessels that provide blood flow to the legs. And peripheral arterial disease also more likely to happen in men. So, and then the last thing that is specific to men, and we'll talk more about, is that one of the complications of diabetes for men can be erectile dysfunction. And so that's something we're going to talk about a little bit. So if that's not something you want to hear, you don't have to stay tuned, but I think it's an important health issue, and that's why we'll talk through that. So let me get to my next question. What type of diabetes is more common in men? Is it type 1 or type 2 diabetes? So I'm going to just take a moment as a refresher for those that maybe hadn't watched previous episodes, and just tell you the difference between type 1 and type 2. So type 1 is the less common disease, and it is an autoimmune disease. And what happens is the body's immune system destroys the cells of the pancreas that make an important hormone called insulin. Insulin is the hormone that helps control one's blood sugar in the right range. So autoimmune disease, immune system destroys the cells that make insulin. People make no insulin. Their treatment has to be insulin. Typically that's in kids, but it can happen at any age. And that's about 10% of people with diabetes. And that's true for men also. The minority of men with diabetes have type 1 diabetes. So what do most men with diabetes have? It's type 2 diabetes. And what is type 2? So type 2 is two problems at the same time. Problem number one, they become resistant to the effects of that hormone insulin. So that hormone that controls blood sugar just doesn't work very well in people. And what does the body do to compensate? Well, it makes extra insulin to try to compensate. So problem number one is being resistant to the effects of insulin, problem number 2 that leads to diabetes, to type 2 diabetes, the second problem is the ability to make that extra insulin. They can't quite make enough extra insulin. And so they're resistant, they can't make enough, and that's what leads to type 2 diabetes. And that's the more common form of diabetes. Can happen at any age, but tends to be more common in older individuals, less common in children, but it's happening in kids now because of the epidemic of obesity. So that's the answer of what type of diabetes is most common in men. It's type 2, in case you get a quiz. All right, let's move on. Let's go to question number 3. And again, thank you for giving me your questions. And again, this is Ask Dr. Bob, and for those of you that are tuning in a few minutes late. So here's a question: how often should a man living with diabetes be going to a primary care provider? Well, that's a very good question. Some of that depends on how well things are going. But we recommend that most people with diabetes should be seeing their healthcare provider every 3 months, every 6 months at least. But many people every 3 months. And it all depends on what issues you have as to how often that is an important thing to visit. One thing I'll mention is, we're all hopefully starting to come out of the pandemic. And one of the things that we know, and we actually surveyed this around the country, the American Diabetes Association surveyed this, we found that probably somewhere around a quarter of people delayed seeing their provider because of COVID. And in the early days, that was the safe thing to do. And a lot of people saw their provider virtually, which is great. Now that things are getting better, it's time to reconnect with your healthcare team. And that's true for all you men and women out there. So keep that in mind. Next question. What are the signs and symptoms of diabetes before diagnosis? And is that anything different in men? Well, the signs and symptoms are largely the same. And it can be blurred vision, it can be weight loss, can be excessive urination, particularly at night, excessive thirst. Those are some of the common symptoms. But keep in mind that for type 2 diabetes, most people have no symptoms. And that's why a quarter of the people with type 2 diabetes don't even know they have it. How can you know if you're at risk for diabetes? Really easy. The American Diabetes Association has a risk test. We have a risk test on our website. It's a series of questions, takes a minute to complete. It will tell you what your risk of diabetes is. And how do you know? How can you be diagnosed? Simple blood test. Any healthcare provider can do that, and you'll know whether you have diabetes or not. So those are the signs and symptoms. Next question. Are there any additional complications with diabetes that men may experience? And I started off with that, and let's talk more about that. So the symptom that is more unique for men is erectile dysfunction, and that is difficulty having and or maintaining an erection. So what's going on there? Why do men get that? And what's the connection with diabetes? So diabetes is a leading cause of erectile dysfunction. Important to know. Erectile dysfunction is a combination of a nerve message and a blood flow issue. So what's happening physiologically for men to have erections? And I'm going to have to explain this in medical terms. It is a nerve connection to tell the blood vessels in the penis to dilate, to allow more blood flow, and then allow the erection to occur. And so there can be various problems there where erections may not occur. And what are those reasons? Well, one is problems with blood flow. And um, one of the complications of diabetes in general is damage to the blood vessels. That's why people with diabetes are more risk for heart disease and peripheral arterial disease. Well, it can also affect the blood flow that's responsible for leading to erections. And when that happens, there can be erectile dysfunction. Couple of things about that. So that is one cause. The other cause is not having enough of another hormone, testosterone, the male hormone. The male hormone is also necessary to have normal erections. And so there are various causes where testosterone may not be made. And that's why it's important to a few things. One, men, if you are having erectile dysfunction, talk to your provider, talk to your physician, talk. We know that men tend not to bring this up. It's a little awkward. It's a little embarrassing. It can be, but you got to speak up, because if you don't speak up, you can't get treatment. And treatment works in many, many cases. So what are the treatments? What can be done? Well, you've probably heard of medications like Viagra and Cialis, a number of medicines that are effective for many men that have erectile dysfunction. First step is to figure out why. Is it diabetes in and of itself, or is it that one doesn't make enough testosterone? So these are things that your healthcare provider can help sort out for you and then get you on the right treatment. Some people don't react to those drugs, and there are other treatments. And again, your primary care provider can help. And then there are specialists that focus on this, urologists. And seeing urologists, they can offer other treatments. And so this is very often a treatable disease, and it can be a complication of diabetes. And guess what? You can help to prevent it. How do you do that? Good blood sugar control. Controlling your diabetes can prevent developing erectile dysfunction. And for some men with erectile dysfunction, getting better blood sugar control can help treat it, can help improve it. So, there are many reasons to control one's blood sugars. For men, this is just one more reason. So keep that in mind. So let me move on to the next question. So what are the most common age of diagnosis of type 1 and type 2 in men? And so, again, type 1 or type 2 diabetes can happen at any age. And that's something that we've learned over the last bit. We used to think of them as juvenile diabetes and adult diabetes because we thought one happened in kids, the other adults. We don't call it that anymore, because either type of diabetes, type 1 or type 2, can happen at any age. But type 1, more likely to happen less than age 40. It's less common after age 40, but can happen. I've seen a number of individuals develop type 1 diabetes at age 60, 65. It's always possible. And type 2 tends to be over age 40. So that's that question. The next question is, are there nutrition recommendations that are different in men with diabetes compared to women? Well, not so much so. I would say that the nutritional recommendations for people with diabetes, a lot of it is similar to what's good, healthy eating for all of us. I would say that men are more likely to be obese than women, and therefore thinking about a meal plan that can help lose weight could be more important for people that are overweight or obese. And I will also mention that, as I said earlier, men with diabetes are more likely to have high blood pressure, and the people that have high blood pressure often need to be watching their salt intake. So recommendations on nutrition are sort of the same, but maybe depending on what other what we call comorbidities, other diseases that you may have along with your diabetes could dictate what your best meal plan might look like. Okay, we are moving on in questions. And again, throw them in the chat if you have other questions that we're not talking about. So here's a really important question. I'm glad somebody asked this. How important is mental health in men living with diabetes? Well, it's really important. It's important for men, it's important for women. But here's the observation. Men, we tend not to seek help for mental health, much less so than women do. We try to be sometimes the strong, stereotypical man and not talk about our emotions. We have to. Diabetes can be challenging. Talking about it really can help. And so I encourage men to talk about it, get support. Who do you know that can help support you? Who in your family, who amongst your friends? And sometimes the first step in that is just being open about it. I think I hear this from my patients over and over again. They develop diabetes, and all of a sudden, because of conversations, they start to realize, wow, all these other people that they knew have diabetes, and they never talked about it. And so talk about it, be open with it, and you will find other people that have diabetes. And one great way to deal with some of the challenges of diabetes is to have support from your peers. So I really encourage that. There are also all sorts of resources out there. The American Diabetes Association website has a wealth of information about mental health. In particular, we have a directory that helps you find a mental health professional that is expert in diabetes, that has gone through a training program, that we know not only do they know how to take care of mental health, but they know about diabetes as well. And you can find a provider there. Be open to talking about it. Be open to seeking help. There's nothing wrong with it. In fact, we often think that almost everybody with diabetes could use a checkup, a check-in with a mental health professional just to see how things are going, how you're doing with it, how are you adjusting with it. It's a serious disease, and it affects us in many different ways. And the better we are up here, the better the rest of our body is. So please be open to that. Be open to that. And another suggestion is, because diabetes is challenging, and it can be 24/7, think about what you enjoy and what recharges your batteries, and try to do a little bit more of that stuff. We need it now more than ever as we've all been living through the pandemic. Get support from other people, plug into the things that you enjoy that give you sort of that joy in life. Okay, next question. So are minority men, Latino, African Americans, impacted by diabetes differently? Well, the disease isn't necessarily different in those individuals, but the risk of disease is higher. So as an example, Latinos, African Americans, more likely to develop diabetes. And sadly, when they develop diabetes, they are more likely to develop the complications. And so, one statistic that is really sobering is that the risk of amputations is twice that in Black men versus white. So they have twice the risk of losing a limb, and losing a limb can be a very serious complication of diabetes, not only because of the health impacts, but also we're talking about mental health and the psychological impact of an amputation. Again, like complications in general, you can do many things to avoid them. And for amputations, as we talked about in a previous episode, get a second opinion before you get an amputation, because we now know that many times those amputations can be avoided. So back to that, different racial and ethnic groups being at higher risk for complications. This has really been something disturbing for us that the pandemic has shined a bright light on. The risk of hospitalizations and death was significantly higher in minority populations and people of color compared to others in relation to COVID infection. And that's why the American Diabetes Association launched a concerted effort to address this. And I encourage you to go to the website, Health Equity Now, and you'll see a whole bunch of resources and information. And part of that is a Bill of Rights that we are advocating for all people, but particularly for people of color, where we know for too long they have not had the positive health outcomes that others have had. So go to the website, take a look at the Health Equity Now website and our Patient Bill of Rights. We are winding down on questions. I'm going to see if we have any additional questions from the audience, and it does not look like we do, so I will take our last question. And this is a perfect thing to end on. So where can I find some health resources to help with my diabetes management? Well, I'm going to give you a website that will have just about everything I talked about today, plus more, that really can help you manage your diabetes well. Because in the end, we as the healthcare team are here to help you do well. And the more you know, the better you do. So here's the website. It's diabetes.org is our overall website, and you can find everything there, and feel free to surf around there. But if you want particular information about fitness and nutrition and mental health resources, it would be diabetes.org/healthy living. And again, so go to the website, Google us, you can get that information. Really take advantage of that. And thank you all again for joining. This is really a pleasure for me to do. I appreciate all of your questions. This is Ask Dr. Bob, and I am Bob Gabay, the Chief Scientific and Medical Officer for the American Diabetes Association. Thanks so much for joining, and see you next time. Tell your friends. Be well.